City Council has taken a giant leap forward to address the maternal health crisis in New York by passing an historic maternal health package.
These bills expand access to maternal health services and address some very specific areas of maternal health services and issues that have perpetuated health disparities for Black women and other women of color. They also
So more than 24 women die every year in New York City due to pregnancy-related causes, and based on the data, nearly 80% of those deaths can be avoided. Joining us this morning is Brooklyn Councilwoman Jennifer Gutierrez, who had a hand in crafting this historic legislation. So good morning, Councilwoman. Thank you for being here this morning and joining us.
Good morning. Thank you for having me.
You know, we've been laser focused on this, covering the maternal health crisis even before the pandemic began, right? In New York City, as you know very well, women of color 8 times more likely than white women to die from pregnancy-related causes. So I guess the question is, why did it take so long, right, for city leaders to address the issue?
Yeah, that's a great question, and something that I discovered in my own maternal journey and then transitioning into becoming a council member is that there's been a whole movement of midwives and doulas and just reproductive health right advocates for close to 35, 40 years trying to get attention to this grappling statistic and trying to get policy and funding to back up this program. And so I can only tell you what I believe to be true, which is now that this council is majority women. We are led by the first Black female speaker. And we also have support from our public advocate and our borough presidents and our mayor in a really meaningful way that I think all of that together is what has made this package possible.
Yeah, and like you said, the statistics are so disturbing. And now there are some specifics that these bills call for, including more transparency from New York City health officials on maternal mortality. So what are they now required to do?
So one of the, and there's about 5 bills in the package, but one of the bills, which is the one that I co-sponsored with Councilmember Lewis, is requiring a doula pilot program. And aside from offering doula services throughout the year through June of 2024, is a report that we will require the Department of Health and Mental Services to provide to the City Council, really letting us know the doulas, the amount of services that they provided pre and postnatal care. What we're also hoping to get out of that report is just how necessary, right? We want to be able to monitor women and pregnant people's health from the beginning till after, and determining if the additional resources, which we know to be true, have made a more positive impact. Did we see a reduction in the amount of women being negatively impacted by lack of services? So yes, the reporting and transparency is key.
You're talking about, you know, the portion of the bill focusing on bringing those doula services to all 5 boroughs, right, in those low-income areas. How do you think it's actually going to be received, and will they be provided in different languages?
Yeah, so I think it's going to be received well. We know for a fact that doulas and midwives, it's an ancestral indigenous practice. My own grandmother was a midwife. She delivered many of my cousins, her grandchildren, and it's a really key practice in Black and brown and indigenous communities. So it's something that's familiar. A lot of the pilot programs will be started in 33 priority neighborhoods, which are predominantly Black and brown neighborhoods. And yes, the language access will be key. We know this. My own experience at Woodhull Hospital, I can tell you, I worked with a midwife who I love. I had a doula. I was very lucky. Both were women of color. And so that's going to be key. A lot of the initiatives also create pathways to be able to train more doulas. So the idea is that we are also recruiting more people into this profession that can speak the many languages represented in the city of New York.
Yeah, that comfort level is so important. Now, well, there's also a portion of the bill that directly addresses C-sections. Why was that so important?
So I'm not super familiar. It's not on my particular bill,
okay,
but I think it's because traditionally, though, to be honest, because this package of bills focuses in public hospitals, historically, New York City hospitals promote C-sections and utilize C-sections a lot more than not. And so I think the idea is to utilize what we know, providing more doula and midwife services to hopefully move away from that. Okay. Not every single hospital does that, but traditionally that is the case. So we do what we know from these phenomenal people in this industry is that C-sections have a much higher risk. We see this particularly with Black women, even after delivery. So we do want to move away from that. So I think that's why the emphasis
obviously
is there.
More invasive.
Yeah. And so when will the services start being provided, right? Because that's the $1 million question.
Yeah, they should have yesterday, but October 1st is the official start date. October 1st is the official start date. And a couple of the bills will detail just how long, but in general, October 1st through June of 2024 is where a lot of these pilot programs will run through, and then we'll have reports. And then what I'm hoping we'll see is what we know is that these are super beneficial, that we're promoting preventative care, and that we're really grounding ourselves in this like ancestral practice, and be able to continue to fund it citywide and expand it for every pregnant person in New York to experience.
Yeah, such a huge step, such a huge and important step for moms to be and moms.